exam week.
How did you do?
Well, I'm struggling. You know, I'm a freshman, so I'm struggling, but we're going to see how that comes with midterms.
Oof. Yeah, I had exams too. I'm taking a science course. Not so fun. I'm a communications person. Why would they stick me in a science? I had to take science, you know.
Right. Well, like I was saying earlier, as you know, last week we discussed Latinas and healthcare. To follow up with this week, we have reporter Lindsay Bernal on the street talking to Latinas, seeing what they know and how they feel about healthcare reform.
Hey everybody, today we're in the quad at Texas State University, and we want to discuss some healthcare issues among the Latino community and find out just how many Latino students realize how things are affecting them. Approximately 32% of Latinos under the age of 65 are currently uninsured. According to the National Institute of Health, Latinos face more healthcare problems more so than other cultural groups in the United States. Some of these factors include obesity, asthma, cardiovascular disease, and diabetes, just to name a few. These are definitely concerns to be aware of, and if at all possible, have insurance to take care of them. I'm here with Jaslina Olivares to talk to her about healthcare and what is affecting her. Jaslina, tell me, do you have insurance at the moment?
Yeah, I am currently insured by Blue Cross Blue Shield. It's my mom's insurance. She gets it through work. So.
Right. And have you always had a health insurance?
Yes, but this summer, for the first time, we actually kind of experienced falling through the cracks, I guess you could say. Right. She was switching jobs, and we didn't have insurance for about a week period when they were going through the paperwork process, and I got really sick and I wasn't able to get treated because it was going to be really expensive. So right. I kind of felt firsthand what it was like not to have insurance for the first time. And it's horrible if you can only go to the emergency room when you get a cough or a cold. It's really expensive. The medications are outrageously priced, and I really do think it is a necessity. Everybody should be provided with it. As a whole, the U.S. has really noticed that healthcare is really poor in our country where it should be really good. I mean, we're one of the richest nations, and I just think that the media, yeah, they maybe might want to put more emphasis on it, but I think it's starting to like build up. I think people are starting to notice that, hey, this isn't fair, and we really do all need universal access. So
we've never really had insurance since I was a kid. My parents are self-employed, so they never had that like through an employer, and just growing up, I mean, I guess it's maybe they just didn't have the resources or the information to actually get health insurance, or maybe they think it was too expensive. Definitely, if you have the option to go see a doctor just whenever you're sick for anything, they can prescribe something like to get rid of whatever you have quicker than just like taking over-the-counter stuff. And I mean, yeah, it'll benefit. It'll be a big benefit if we had it. But I mean, you know, we just never really did. If there was a way to communicate with them, something maybe like in their means, yeah, I think they would definitely, you know, go ahead and get like a health insurance plan.
Would you say that that's definitely a benefit to have among your family, and would you say that it's a necessity really to have?
Yes, I feel it's very important to have health care, especially that I have parents that are retired, and you know, with all the flu that's going around, and it's just important to have health care.
Well, there you have it. Health care among the Latino community. Should you be insured? How do you feel about Obama's health care plan? These are all questions not to be thought lightly on, but ultimately the decision is yours. What will you decide? I'm Lindsay Bernal for Latina Living. Adios.